Artificial leg nilianza kutumia nikiwa mdogo sana. Maisha yangu ilikuwa yani comfortable sana.
Nilikuwa mtoto wa miaka 3 nikagonjeka polio. Ndio sasa nikapata ulemavu.
Mguu yangu alipata accident wakati ya clutches. Ilipigwa risasi kamalizwa mapupa yote.
Ile pastoral areas na ile challenges anapesi ile able. Kama uje pia area hii ni maisha yake ni ngumu. Je, na ile mtu disabled anakaa maisha gani?
Turkana County is the largest arid and semi-arid area in Kenya with a population of over 1 million people. It is a drought-prone area that experiences frequent, successive and prolonged spells of droughts. The region also has a high illiteracy rate and as a result has lagged behind in development for decades. Turkana has a high number of persons living with disability. Most people living with disability in this region live in abject poverty and have limited opportunities to access education, health, suitable housing and employment opportunities.
Compared to the rest of the country, the numbers of people with disability is a bit higher. The main reason probably being the high levels of poverty. Even cases that could be prevented, like earlier on in the years, things to do with immunization coverage was not really very good in this county.
Conflict and insecurity in the region has also led to needless loss of lives, displacement of households, loss of livelihoods, trauma and physical disabilities. Traditional beliefs of the community have also had a great negative impact on health-seeking behavior of the people. Most hold beliefs that disability is caused by evil spirits or curse from the gods. Children and adults with disability are enclosed in their homes and thus prone to missed opportunities such as schooling and health due to the social stigma against people living with disability. Save the Children, with funding from the Christian Blind Mission, CBM, implemented a disability mainstreaming project in Turkana County from January 2014 to April 2015. The project seeks to improve the lives of persons with disability and create an inclusive society by increasing awareness on disability, preventing physical impairments arising from avoidable and vaccine-preventable childhood diseases through facilitation of health education, nutrition and immunization programs, provision of direct support and referral services to children living with disabilities.
Disability Mainstreaming Project is the project that has been supported by CBM to mainstream several issues that people living with disability are facing in the county.
The main aim of this project was to improve the quality of life for people living with disabilities in Turkana County.
The program is being implemented in Turkana Central, Turkana North, Turkana South, and Loima sub-counties of Turkana County. The project has directly reached over 1,000 persons with disability and 5 disability groups in the region. Save the Children has been working with a number of stakeholders and partners in Turkana County to achieve its objectives.
We've been coordinating so much with Save the Children on issues of training, especially on the economic empowerment aspect. We've been doing medical assessment together with the Ministry of Health.
We normally partner with Save the Children in aspects of sensitization so that disabled persons are not left in secluded places.
Save the Children, we've partnered with them in provision of assistive devices to the persons with physical disabilities in Turkana. They normally refer clients to our Center for Provision of Assistive Devices. Save the Children normally meets some financial cost for those children. And they also offer some trainings to us, like the past 2 years they offered some training to us on the wheelchair technology and also on community-based rehabilitation program.
Save the Children recently built as a physiotherapy unit Most of the patients, especially the orthopedic patients, are rehabilitated in the physiotherapy units. That is probably more preventive, and those who are already disabled are assisted in many ways. For example, providing crutches. Those under rehabilitation, they're providing also these walking frames.
Approximately 1 in 20 children in the world has a disability. Children with disabilities may face neglect or reduce access to care, with malnutrition as the leading cause of death among the children with disability. As a result, the project sought to establish and promote child-friendly environments for children living with disabilities in schools and health facilities by constructing ramps to ease mobility.
Mimi kwa jina ni Philip Edapal. Ulemavu naye nilipata nikiwa mdogo, ambapo sikujua kiini kabisa. Lakini kufikia mwaka wa 2010 ndio ulemaji wangu ikasidi. Sasa vile ugonjwa sasa ikanipiga tano bwana moja. Kitambo nilikuwa ninatumia stretcher ambayo hiyo, lakini ilikuwa inaniumiza hapa. Na sasa vile nimetumia hii, kwa vile inashika nusu ya mkono yangu, abiti hii naye imekuwa afadhali kushinda ile ya kwanza. Vile nimetumia hii, sasa inafanya urahisi yangu wa kutembea hata, unaona. Na toka hata lodo na sasa tembea.
Hii artificial leg nilianza kutumia when I was nursery school. Fika class 8 zika break down. Yaani kaharibika. Sasa wheelchair nikatumia kuja shule ndio ilikuwa shida, but venye nilikuwa nyumbani ilikuwa tu vizuri because I had sisters wenye wangekuwa wananisaidia. But hapa shule kila mtu ana save time. Sasa ukichelewa DH itakuwa difficult sana kwenda tena class mtu kukusukuma, or mwalimu anaweza fukuza watu yani unabaki peke yako DH. Sasa venye nilipata nikarudi shule. After shule sasa tuko sawa. Class lesson na attend to poa. Yani si waste much time. Ingawaje hata kama kuna venye natembea polepole, but si much time venye nilikuwa na waste nikiwa na wheelchair.
Ako ni talay tanong ni alam mo riyalo kita na be nangarta le oy ikriya ba ngango ne ora ba chenye ko nrobo naga nagarang ita tengene ekere ba jan ka gongo
yanu bilari ko lon apato ya wuto ngado wangu.
The project also provided seed funds to select disability groups so that they can start businesses to boost their economic status.
Yang rupiah kalau wanita dia mana kampung na tegiala tado wa pikipiki. Abazi pikipiki na bongi na ngarakin tezo wako tere.
Sisi kwa grupu yetu tumesaidika kimawazo. Tumeweza kupata skills ambazo hatukuweza kupata kitambo.
The Disability Mainstreaming Project plans to roll out to other areas of Turkana County and reach even more persons with disabilities in an effort to improve their lives.
Disabled people are more than the resources available, and we have not been able to reach all of them. So we are still fundraising with our donors to try to scale up the activities we have been implementing. We still want to strengthen the engagement between the disabled people and the local authorities. The other thing is to increase awareness still on disability so that the stigma is reduced at the household level and even at the community level so that they can bring them out for possible support.
Future upcoming program will focus on children with disabilities. It will focus on improving access to health, nutrition, and livelihoods. There is a great need to develop strategies to empower persons with disability, reduce their poverty levels, make them self-reliant and able to participate in national development in an effort to impact more lives in the region.
Unajua sisi watu wengine tulikuwa tumejidharau sisi, tukisema tu sisi ni watu walemavu, tutaweza kufanya nini katikati ya watu wazima ambao wako wima. Tangu Save the Children aweze kutusaidia, maisha yangu imebadilika, hata nimekuwa na mawazo ya kufanya kitu. Nimejiona hata mimi ni mtu, ninaweza kufanya kitu ya kusaidia mimi pamoja na watoto yangu.
Wakintizo hala karalo kwa jokoni, kizaki bochi ya keendelea, akingaraki niziwa.
Hiyo pesa tunaona kama anatusaidia. Tumefunika uchi yetu.